Hi there, good afternoon, good evening. How are you doing? I hope you are doing well. How are my guys there? My men in the house, how are you doing? I hope you are doing great. I'm so sorry that I did arrange for this video by 11, but for some reason I think I did this video, but I'm not sure where the video has gone to. It has just disappeared. Maybe I've deleted it because I was doing it in a hurry because I was still working. So I just want to do this video. I believe that maybe someone is going to benefit from it. So, and when you see videos missing like that, I think maybe God wants to save somebody. Alright, so welcome to Clinic Affairs today, and it's me, your Dr. Tracy, in the house. So today I am going to be speaking on benign prostatic hyperplasia or benign prostatic hypertrophy, and I put a title there that not all prostate enlargement means cancer. Okay, not all prostate enlargement means cancer, because some of our men, black men, Asian men, Caribbean men, once they have their prostate enlarged, they are so scared that they have cancer. So today my little advice today is just to encourage the men that may have signs that will show that maybe it looks like sign of cancer, but I just want to speak that not all prostate enlargement is cancerous. So what is benign prostatic hypertrophy? It means benign means not cancer. Hypertrophy means excess growth, right, of the prostate gland. And the prostate gland is one part of the male sex organ. Is located inferior to the bladder and adjacent to the urethra. So adjacent to the urethra. Ella, can I have that paper I drew? I make a little drawing there. You see a paper I draw? Yeah. Thank you. That's it. Yeah. Sorry. I just want to show you. I tried to draw. I'm not very good, so don't laugh. So I have, I'm not sure if you can see. Yeah, so this is the bladder, and this is the prostate gland, and this is where the urine flow from the bladder, it goes down, right, through the urethra, and you can see that, okay? And when it is enlarged, which is this one, the prostate now start to push up on the male urethra. So when this bladder is full, when the prostate enlarge, it will block up the urethra here, and urine will struggle to flow out. Alright, so I just wanted to show you so that the prostate lies side by side to the urethra, inferior to the bladder. I'm just trying to make it very simple for anybody to understand. So now, when we talk about the growth of the prostate gland, so according to WHO statistics, that 1 in every 6 male and in a lifetime will end up having prostate cancer, just like 1 in 8 women will have breast cancer. So prostate enlargement means that the prostate gland is growing. And bad news is that a child is born and they grow up, age of puberty, prostate stop. But when someone is 25 years old, the prostate starts growing again, and it's one gland that is always growing. Like our nails grow, our prostate grows like that. So unfortunately, some people may not feel it, but some people will end up being a victim of this prostate enlargement when the prostate will occlude the urethra. So what patients do we see prostate enlargement? So people from age of 80 upwards, statistically, are supposed to be the one that have prostate cancer. But unfortunately now we also have young people in their 60s. I'm not saying 60 is young, but someone in their 60s, they still have life to live. Some people are 60, some are 70, some are even less. They present to the hospital with prostate hypertrophy. Hypertrophy means excess growth. So now the problem is, for layman who is not medically inclined, when they start to have the symptoms I'm going to discuss, they begin to feel that they have prostate cancer. Some of them will end up doing something stupid to themselves, maybe like taking their life because they do not want to get to that diagnosis. And others don't even know what is happening. They will think they are having diabetes. And that's why I always say that self-medication is wrong, because some signs and symptoms of prostate enlargement will also mimic like renal failure or someone that is having diabetes. So I'm going to explain so that you can know a bit of difference between those things. So every 5 years, the prostate gland enlarge. Every 5 years, it's enlarging in nature. So now, how do you know that you're having problem? So what are the signs and symptoms of prostate hypertrophy? Benign prostate hypertrophy. I say benign means it's not cancerous. Hypertrophy means the prostate gland is growing, is enlarging. And because of this, a lot of times black men and Caribbean men, they have this and they don't look after themselves. So please listen to this video. So the first sign is of prostate hypertrophy is what we call nocturnal polyuria, which means that or polydyspepsia, which means that in the night or frequent, let me put it simple. In the night, the person have what we call frequent micturition. They have frequent going to the bathroom to pass water. So in one night, they can visit the toilet over 6 to 8 times in one night. And then the problem is when the prostate is enlarged, when they visit the toilet, they end up having their urine very little. You know, the urge they had that pushed them to the toilet cannot be compared to the amount of urine they are passing out. So they will just pass a little urine and then they go back to bed again and they want to go again. And also some of them have they are very urgency that if they don't do it, they're going to do it on themselves. Unfortunately, when they get to the toilet, they cannot do it. They do it but very little. So that's number one sign of enlargement of prostate glands, which means that it starts to block the urethra, so urine is not flowing freely. So after they have that, then there's another thing that could happen is that the urge for them to urinate will continue because they always feel that they have not emptied their bladder, you know, tenesmus, so they always feel that they need to go to the toilet. So it's something that disturbs someone's sleep. And also then the pressure, that the urine pressure that comes from the bladder outside the urethra is going to be reduced compared to a man that does not have prostate cancer. When they prostate enlargement, I'm not talking about cancer today, prostate enlargement, when they go to urinate, the urine just flows out in a big stream of urine, just flows out with strong power and the thing comes. But with someone that has prostate enlargement, the pressure that the urine is coming out is very low. Low pressure. The urine is very low. So, you know, it's not flowing and it's very low. And then, because of the claudication of the urethra, some of the urine is not being emptied. So when the man leave the toilet, they dribble, they dribble, which means that the leftover urine can just be all over the place, and that could also lead to wetting themselves and some discomfort as well. And worst case scenario, some of them will also have what we call hematuria. They can also have blood in the urine. Because of the obstruction of the urethra, it can lead to upper renal infection, and it can also lead to something like pyelonephritis, and it can also lead to a renal failure and things like that. So when you find that any of these things has happened, then you need to speak to your doctor. So now, how do you differentiate that from diabetes? If you are having diabetes, when you are going to the toilet frequently, you have to urinate a large amount of urine. So it's like as you're drinking, if you drink 200 ml, you go to toilet, you're going to urinate almost all of it, or all of it and more. So that's diabetes. But for enlargement of the benign enlargement of the prostate gland, and the urine are smaller, but coming very frequently. All right, so I've given you about the sign. So how do we actually diagnose this and differentiate it from being cancer and not cancer? So when you come to hospital, the doctor will examine you. So we will examine you, we'll do what we call abdominal examination. And so down on the abdomen area here, we call it pelvic floor, pelvic area. If you do the abdominal palpation down to the pelvic area, you're going to see that the bladder is retaining urine, because that's another symptom, retention of urine. So the bladder will be enlarged. Remember, the bladder is like a balloon, like I drew here. This bladder here, I'm sorry, you can see the way they look like balloon, especially when the last one, when it's obstructed, you can see that there's a backflow of urine, and also there's also an hindrance of urine flowing to the urethra, and it causes the bladder to enlarge. So when we're doing abdominal examination, the first sign to know that the bladder has the prostate has occluded your urethra, you will feel a mass on the pelvic area, which is very enlarged. And then that's number one. Number two, we're going to do what we call digital rectal examination. So when we examine the patient, then we're going to go through the back area, the anus, and we'll examine it, and then we will feel for the prostate gland. So it's very easy to pick up the enlarged prostate. Okay, so we pick it up, and the surface of the prostate gland, when it's not cancerous, when it is just what we call benign prostatic hypertrophy or hyperplasia, is very smooth. It's swollen, it's enlarged, but the surface is very, very smooth. So that's a confirmation that that is not cancer. And then also, if it is cancer, when you do examination, the surface will be very cracky, and bumpy. So that is how we examine it and be able to know that this is benign prostatic hypertrophy. We call it BPH, and it's non-cancerous. Next one. So next thing now is, how do we treat the patient? So we have to we have a framework that we use for grouping your symptoms, and we group the symptoms of patients from mild to moderate to severe. So patients that have mild symptoms and they can manage themselves, maybe you need to have some things to pack yourself, like diapers or something, pads. They have adult pads. You just wear it and wear your trouser and go to your work. If you can manage yourself, that is fine. Because when patients that are having mild symptoms get treatment, sometimes the symptom becomes worse. So when the doctor do your grading, you ask them, am I in mild, medium, or mild, moderate, or severe? If it says mild, the doctor will tell you treatment is not needed. But that's medication is not needed. But you need to do what we call lifestyle modification. So you need to do lifestyle modification for yourself. Number one thing you need to do is for you to stop taking caffeine. We call it coffee. Because those are diuretics. They make you to urinate quite a lot. So you have to stop taking coffee because it makes you urinate a lot. And number two, you have to stop drinking alcohol. Because alcohol also is diuretic. It also makes you to go to pass a lot of urine, So that's number two. And number three, you also have to stop drinking large volume of water in the evening. Large volume of water, you have to stop drinking it in the evening, okay? So, and that will reduce the number of urine that is produced in the kidney, and also will reduce the amount of urine in your bladder. So, reduce the fluid. So, and that is it. And then the next thing is you need to reduce constipation. 2 weeks ago, I made mention of constipation, that it is one of the things that lead to hemorrhoid. So today again, I'm telling you that you need to stop putting yourself in constipation if you're having any enlargement of prostate, or someone that is suffering all these symptoms I'm mentioning. You can advise them to go and see the doctor. You have to eat healthy and drink a lot of water during the day, and eat food that are rich in fiber, and eat a lot of fruits as well. That will help your bowel to go smoothly. So now, if someone is having moderate symptom of benign prostatic hypertrophy, so those kind of people, they can, in addition to the lifestyle modification that I've said, they can give them what we call alpha blockers. And one of the medicines that's very popular is called tamsulosin. So you're gonna take that, and for that to help to reduce the growth of the prostate, block up the dihydrotestosterone. Because dihydrotestosterone is the hormone that influences the growth of the prostate gland. So when you take tamsulosin, is an alpha blocker, so it will block the production of that dihydrotestosterone. So that is why men that are castrated men do not have this prostate enlargement, because they are castrated and they are not producing a lot of dihydrotestosterone that makes the prostate to be enlarged. So if you are moderate symptoms, you get the tablet that I've just said. But if your symptom is severe on that scale, so it's going to be direct referral to surgery, and you'll be surgically removed, and because lifestyle adjustment, medication, and then surgical removal, and then the doctors will be following up on that. So that is me today about benign prostatic hypertrophy. So if you're a black man there, I say hello to you. If you're a Caribbean man there, I say hello to you. Indian man, I say hi to you. And I'm saying to you, listen to this message and write down your symptoms. Maybe you need to see your doctor, just to let you know that that is not cancer. But if you don't go on time, then it can move on to become cancerous, because most of the things tumors happen as benign, and if nothing is done about it over time, it can now change the form to become malignant. So the stitch in time saves 9. The earlier the better. Thank you very much, and stay with me. See you next time. Bye. Don't forget to like Cleaning Affairs.